All right, we're going to have a little change of scenery as we talk about VBAC, or your choices really between vaginal birth after cesarean section, VBAC, and elective repeat cesarean section. This video can be beneficial for you to watch if you're worried about what happens after you have a cesarean section delivery, even if you've never had one before, or if you do have a history of having a baby this way and you're wondering about what your options are in this next pregnancy. So if you've had a previous cesarean section delivery, you have a choice to labor and deliver vaginally or to plan a repeat cesarean section. VBAC is a safe choice for most people who have had a cesarean section before. However, you may prefer to have an elective repeat section, or it might be the safest choice for your particular clinical situation. In Ontario, with people having midwifery care, VBAC was planned for 70% of clients with a history of cesarean section, and 70% of these labors resulted in a successful vaginal delivery. So what that means is that most VBACs happen as planned. Some things that will increase your chance of having a successful VBAC or vaginal birth after cesarean is if you had a previous vaginal birth before your section or after your section. If the reason for your last section is not a factor this time, for example, breech presentation at term, high blood pressure, or abnormal fetal heart rate in labor. We have some decreased rates of VBAC success if you had a previous cesarean section with failure to progress, if you have an induction of labor or augmentation of labor this time around, if your BMI is on the higher end, so above 25 to 30, or if you are over 35 years old at the time you are planning your VBAC. There are some significant benefits to planning a VBAC. So for the birthing parent, the benefits include no abdominal surgery, lower rates of postpartum hemorrhage, a shorter recovery and therefore shorter hospital stays, future family planning considerations. So if you're planning a large family, many repeat cesarean sections can increase the scar tissue in your uterus and can cause some complications with your placenta in future pregnancies, and the risk of complications of surgery can also increase. So having a VBAC can help avoid future complications due to repeat cesarean sections such as transfusion, bladder injury, the placenta attaching to the uterus abnormally, hysterectomy, which is the uterus being removed to help control extra bleeding during surgery. We have fewer postpartum fevers and less postpartum discomfort. Benefits for the baby include earlier initiation of breast or chest feeding, higher rates of exclusive breast or chest feeding at 3 to 6 months, and less respiratory distress after birth for babies born vaginally than born by C-section. So what's the big risk with VBAC? Why doesn't everyone choose it? And why is it not recommended for some people? This risk is uterine rupture. It's when the uterus splits open, usually along the scar tissue from the last surgery. Thankfully, uterine rupture is rare and happens in about 0.5% of the time, and most often both parent and baby recover well. However, in a small number of these occurrences, it can have serious and sometimes life-threatening effects for the parent or the baby. The risk of rupture does increase with each cesarean section if you are planning to labor. With each successful VBAC, the risk then decreases. What makes it safe to consider a VBAC? Standard of care is to offer VBAC to clients with one previous lower segment cesarean section delivery, where the time in between the current due date and the date of the last C-section is at least 18 to 24 months. Contraindications, or reasons that a VBAC may not be the safest option for you, include if you have a previous C-section with a classical or inverted T-uterine scar. These are not commonplace for term C-sections, but your midwife will request your operative report from your previous C-section delivery to help you make an informed choice about this. If you had a previous surgery that entered your uterine cavity, such as a myomectomy, if you had a previous uterine rupture, or if you have abnormal placental or fetal position during this pregnancy, that would be a contraindication to labor in general. Even if you do plan to VBAC, you may still need to have a C-section. This happens to about 1 in 4 who plan to VBAC. Having a C-section after labor has begun is associated with more risks than a planned C-section before labor. So this does sometimes impact people's choices between VBAC and elective repeat cesarean section. Electronic fetal monitoring is recommended during a VBAC delivery, and it is one of the ways that we help to keep you and your baby safe during labor. So because we only have access to this technology in the hospital, we do recommend that VBACs happen in hospital. Like many aspects of childbirth, VBAC and repeat C-section each have risks. They also have their own benefits. Thinking about what benefits and risks matter most to you can help you decide whether to plan a VBAC or your repeat C-section. I have linked some great reading for you in the description, so have a look. These can be great for you to read, like I said, if you've had a C-section and you are pregnant again, but it can also be helpful for you to know what your options are if you do end up having a C-section for your first baby. So take a look through, and if you have any questions or concerns, as always, talk to your midwife.